So I've had over 10 years of experience in the clinical environment and being a diagnostic radiographer, but a lot of that was around and in teaching hospitals, and so I really enjoyed working with the students and sort of getting their knowledge instilled to them as well, which is why it sort of navigated me towards the more education and hoping and honing their education to be able for them to become proper diagnostic radiographers. So every day is completely different. The sort of enthusiasm and inspiration that the students give me and have is completely infectious. It's so nice environment teaching because there's so many digital capabilities that help enhance the teaching and all the simulation environments that we create for the students. So they're able to sort of develop those skills and hone to be able to become these allied health professionals that I will be proud to work alongside. On this course, you get to work alongside a lot of other allied health professionals that are, want to be allied health professionals, and especially out in placement as well, you'll meet lots of other professionals other than diagnostic radiography. So it'll instill that sort of more collaborative working, and you'll understand a bigger picture with regards to the patient pathway and the experiences the patient gets while they travel through the different disciplines. It's also a approved course, so once you've qualified and got all the qualifications you need, you can actually go and become and apply for registration and become an actual diagnostic radiographer. So on this course, we have quite a few placement sites that we get our students to go to, and it's about 50% of the time they're out on placement. Over the 3 years, they'll experience at least two different sites, two different hospital trusts they'll work in, so they get a good sort of range of experience and that networking and that communities of practice that they'll build up over those 3 years. Being in the university and out in placement as well, there's a lot of collaboration chances that they have to be able to work with other professionals. They will gain those skills and sort of know how to interact with each other and other different professionals and different hierarchies as well that are out there. We have a good networking and a good relationship with a lot of our clinical partners, and they come into university and do a lot of specialist guest lecturers and talk to the students and sort of instill that motivation and enthusiasm, as well as building that networking a little bit more as well. Come to an open day. There's loads throughout the year. Come armed with questions and your enthusiasm and just make most of the day, and don't leave with any questions unanswered. Also, make sure that you get into a hospital in an imaging department for at least a day to see what it involves being a diagnostic radiographer, so you know what you're going to let yourself in for as well. And plus it adds to our selection events or interview days as well, if you've got that experience and know-how and background knowledge to be able to answer the questions we have when you come.